My name is Theresa and I'm the Director of Anesthesia for the Connecticut Orthopedic Institute here at St. Vincent's Medical Center.
What led you to join IAA?
There's so many things I do love about IAA. It's going to be hard to narrow them down for the purposes of this interview, but the thing I love most about IAA is the culture. It's a very collaborative culture that nurtures professional development and also recognizes the value of personal needs and family life. The team approach here is like nothing I've seen anywhere else. The collaboration, the willingness to help other people, whether it's professionally or personally, is really remarkable. And I'm really blessed to be here.
Do you think that patients can sense great teamwork?
I absolutely believe that's the case. I think what patients really see when they come here is the enthusiasm we have for our program, for our regional anesthesia, for our teaching, and for the really benefit of the patients. When I interview a patient, I tell them that they're going to be enrolled in a protocol, for example, for enhanced recovery after surgery for spine, that we developed here. And we're writing the papers, and we are the cutting edge of regional anesthesia in the country. And that they are going to have the benefit of that. And I go on to tell them you're going to have an 85% reduction in narcotics. And patients are really concerned about that. And we can provide a service here with our regional anesthesia expertise that really decreases the need for narcotics and allows patients to have a nearly opioid-free recovery.
How did you start your fellowship program?
So Dr. Vlad Frank and I have a long history together. We worked together at a previous hospital here in Connecticut. And during that time, we led and developed the regional anesthesia program for that hospital. Subsequently, I went on to found my own regional anesthesia training company, and Vlad came along with me for the ride, and we had a tremendous experience training people from all over the country about how to perform regional anesthesia, and more importantly, how to develop regional anesthesia programs. Because learning how to do regional anesthesia is only one part of being able to successfully launch a regional anesthesia program wherever you go. So naturally, when Vlad joined me here as my co-director of the Connecticut Orthopedic Institute, it made perfect sense to us to develop a regional anesthesia fellowship because we had the experience, the expertise, and the case volume. We're doing thousands of nerve blocks here and cutting-edge blocks that they're not doing at major academic centers. So doctors that would otherwise feel obligated to go to an academic center to get a top-notch regional anesthesia fellowship experience don't have to do that, because what we're doing here is what they're doing at tertiary centers.
How do you continue your medical education and training?
Our team at COI is constantly reading the research, reviewing the literature. And a perfect example is we will get together on a Monday morning at our huddle and talk about a case series, for example, that we read. And then we will bat it off of each other, and we will discuss the pros, the cons, the benefits to the patients. And if we feel like it's worthy of going forward, we do. And that becomes the protocol that week if we have success. And part of the collaboration we have is not just amongst ourselves, but with our surgeons. The surgical colleagues and our team work together every single day so that we can produce the best outcomes. And it's that collegial atmosphere that the surgeons also feed off of, because they know that we're all working together with standardized protocols and have the best interest of our patients at heart.
Why is regional anesthesia important for patients?
Interestingly enough, it's really morphed over the last decade with the opioid epidemic really taking the country by storm, and really no one is immune from the effects of opioids and the addiction and the awful things it can do to families and patients. So patients are very relieved when they get here to find out that they won't be given any opioids or very little opioids, and they can experience a surgical procedure that they feel more like themselves earlier on after the procedure.
How do you manage work-life balance?
I've had some challenges personally at home with some sick family members, and the outreach I got from my partners and nurses and the entire team was so touching. I can't even describe it. The phone calls, the texts, what can we do to help you? Take as much time off as you need from work. I mean, it was unbelievable. Quite frankly, I'm getting a little teary-eyed just talking about it because it was so overwhelming, and it was sincere. There was nothing but concern about my well-being, about the well-being of my family. I'm really blessed. I have the best job on the planet. I'm a very lucky person, and I work with people that I enjoy working with. Most people have a job that they are happy to go to. They go to work, they come home. I can say that I can't wait to come to work every morning. And I've been doing this for 26 years. And the fact after 26 years that I'm enthusiastic about getting up and coming to work and seeing what the day will bring speaks volumes about what it's like to work at an IAA.
What would you say to someone considering joining IAA?
I'm actually responsible for a lot of the recruiting for the Fairfield division. So I am usually the first person that someone who's interested in coming into IAA speaks with. And I have pretty much a spiel I give over the course of 45 minutes, and by the end of it, it's very clear that my enthusiasm is genuine, and that it's a great place to work, and people can sense that because it's easy to sell something when you believe in it, and it becomes very transparent when you're speaking from the heart, and people see that and they hear it, and when they come here, the first thing I say to them is you can speak to anybody you want. Any surgeon, any nurse, any CRNA, any doctor, because I know the information they're going to get is consistent and reliable because they see what they see. We see people laughing, we see people smiling, we see people that are happy to be at work, and that's a gift.
What do you look for in future IAA members?
It's really important to recognize when individuals have an interest in something and nurture that professional development. Because when people are happy professionally, it bleeds over into their personal life. When they become fulfilled at work, often that carries off into when they go home. So we really try to recognize when people, for example, want a leadership position, and we nurture that, put them on committees, give them the opportunity to shine. We don't force that on anybody, but people that show an interest and are dedicated and enthusiastic, we really promote that.
What drew you to anesthesiology?
I chose anesthesia because I'm very procedure-oriented. I like to do procedures with immediate results, and I can see that when I do an anesthetic procedure, whether it's in intubating a patient and successfully intubating them, whether I do a regional anesthetic and I see that they are comfortable immediately. I also like the variety and the diversity. My job, every day when I come to work, I don't know what I'm going to do. It may be a pediatric case, it may be a thoracic case. More often, recently, it's mostly orthopedic and spine cases. But I get to do something every day that is new and exciting, test the limits of my intelligence, my abilities, and that I get to work in an environment that has a very rapid return on what I'm doing. So unlike an internal medicine doctor where they prescribe a blood pressure medication that they follow the patient for 2-3 months before they can see a result, we get immediate results in the operating room. Our return on our investment as far as time is concerned is often minutes and sometimes hours, and I find that very fulfilling.
What led you to join IAA?
I came to IAA in January of 2017 in part to lead and develop the regional anesthesia program for the Fairfield division. It was in short order that I felt like I had been here my entire career. It's that kind of welcoming environment where they nurtured me. As someone who had been somewhere else their entire career and knew no one here, they made me feel like I was a member of the IAA team for decades.
What does the future look like for IAA?
You know, we're blessed to have the leadership of Dr. Tom Bladick, who's really a visionary when it comes to running an anesthesia group. He's been a mentor for me over the years, even before I came here. I'm blessed to have him as a partner. I think the continued growth and expansion of IAA is really exciting. The fact that we're the largest private practice, physician-owned group in the state of Connecticut really speaks volumes about the mission for IAA. Many groups are selling to professional corporations, and that's not on the agenda for IAA. We want to maintain a physician-owned practice because the quality of care is no doubt, without question, better than working for a major corporation and just being a clock in, clock out kind of doctor.